Presentation by Gretchen VAN WYE. She has a Ph.D. in epidemiology, and for about 7 years she's now working at the New York Department of Health and Mental Hygiene, where she's been working with tobacco control and obesity. And now she's, among other assignments, directing the Community Transformation Grants Program, and she'll tell us all about this. Gretchen.
Hi. Okay, thank you. Hi, thanks for having me. I'm glad to be here. So today I'm going to speak a little bit about the Community Transformation Grant in New York City. First, I'll explain what the Community Transformation Grant is. Then I'll talk about why it's important for New York City and what we're doing to address healthy eating and active living. So first, the Community Transformation Grant is something that's funded by healthcare reform in the United States. And so healthcare reform, of course, is the landmark legislation that was just decided upon by the Supreme Court, ruled upon by the Supreme Court yesterday, upheld by the Supreme Court yesterday. The Community Transformation Grant has a prevention fund as part of it, and that prevention fund funds the Community Transformation Grant Program, which has programs and intervention sites around the country that impact 1 in 3 United States citizens. The goals of the Community Transformation Grant are to build capacity to implement evidence and practice-based policy, environmental, programmatic, and infrastructure changes to prevent chronic disease. The areas that we work in for the Community Transformation Grant across the country are tobacco-free living, active living and healthy eating, which I'll be speaking about today, community clinical and other preventive services, so these are things working with electronic medical records and in clinical systems, social and emotional wellness, and then healthy and safe physical environments. Oops. Okay, this is a map demonstrating the locations of Community Transformation Grant recipients across the United States. All told, there are 68 communities and nonprofit organizations that have received these grants across the country. So why is the United States making this investment in chronic disease prevention? So essentially, the chronic disease burden in the US has been growing at a breakneck pace, and the impact that it has on all aspects of our lives, and not just individual health, is enormous. You probably know many of the statistics that I'm going to refer to, but they bear repeating. So more than half of American adults have at least one chronic illness. Chronic diseases lead to the loss of productivity, reduced quality of life, and premature death in the United States. And 7 out of 10 deaths in the US are caused by chronic diseases. Because of these things, 75% of the $2.5 trillion that we spend each year on healthcare costs are focused on chronic diseases. So there's a human suffering component, there's a cultural component, and there's a fiscal component to this for us. By working through the Community Transformation Grant across the country, we hope to achieve improved health quality for around smoking, around physical activity and food, and through systems that improve control of blood pressure and high cholesterol. So now I'll speak why about the Community Transformation Grant is important for New York City. This is a map of New York City, and it's a map of how obesity appears in the city. At the top, you'll see the Bronx, which includes the South Bronx. That is the poorest congressional district in the United States. Right below it, you'll see Harlem. You have East and Central Harlem. And then just below Harlem, you see the Upper East Side, which is the wealthiest congressional district in the United States. On the right-hand side, you'll see Queens. Below it is Brooklyn. And then below that, there's an island. That's Staten Island. That's an island that actually looks a lot like the rest of the United States in terms of demographics and in terms of things like driving and car ownership. 57% of adults overall in New York City are either overweight or obese, but in the neighborhoods that you see that are red, up to 70% of our population is overweight or obese. In addition, 12% of adults, 9% of adults report that they have diabetes, and we know that an additional 30% probably actually do have diabetes because we know that people don't always know that they have this condition. So I'm going to talk a little bit about what we are doing to address healthy eating and active living in New York City within the Community Transformation Grant framework. And this is sort of a selection of the work that we do at the New York City Department of Health and Mental Hygiene, but they're some of our really important core activities. So first of all, the Community Transformation Grant structure in New York City works very closely with the Centers for Disease Control and Prevention, which is the organization that is our national prevention organization, and it grants our funds through these prevention funds that come through the CDC, through the Division of Community Health, which we're very grateful for. So we are accountable to the CDC for all of the grant deliverables associated with the project. We work on the work plans to implement all of the activities across the intervention areas that I'll be speaking about some of them. Components of the Community Transformation Grant include two really important things that really touch on some of the pillars that have been discussed today. Those are our leadership team and our partnership for a healthier New York City. So our leadership team is a small group of individuals representing organizations that are really pivotal to changes in the environment. These are individuals representing key sectors. They include the government, such as the Parks Department and the New York City Police Department, faith-based organizations, the business sector, labor, health equity partnerships, and community-based coalitions. And they leverage high-level support and offer guidance and assistance so that we can reach our goals. And we also have something called the Partnership for a Healthier New York City. This is a coalition across all of New York City that is taking on all of the topics of the Community Transformation Grant. So healthy eating, active living, tobacco control, and reducing excessive and underage drinking. These are things that we're working across at the entire city level by borough-level coalitions, one in each borough. So I'll just be speaking today about the healthy eating and active living components of our Community Transformation Grant. So in terms of healthy eating, we're working to promote environmental changes that increase access to healthy foods and decrease consumption of unhealthy foods. We are encouraging the adoption of healthier food procurement or purchasing standards in both public and private settings. We're continuing to lead and expand something called the National Salt Reduction Initiative. And we're supporting the achievement of baby-friendly hospital status among New York City hospitals. So first, one of the things that we're doing is working to reduce the consumption of sugar-sweetened beverages. Our goal here is to reduce by 5% the percentage of adults who consume one or more sugar-sweetened beverages on a daily basis. By doing this, just in touching on that 5% of the population, we'll reach about 100,000 people. We have 1.8 million adult New Yorkers who say that they consume one or more sugary drinks a day. We're doing this by educating New Yorkers on the negative effects of sugary drink consumption, and we're also working to develop standards for healthy foods and beverages in new settings. So while we have beverage vending machine standards for all city agencies, we actually are developing additional standards that will apply to city agencies that apply to meetings and events that are hosted at those agencies. We're also working on reducing sodium consumption. And now this isn't related directly to obesity, but it's something that's very important for chronic disease prevention. So our goal here is to monitor trends in sodium and key nutrients in the United States packaged in restaurant foods through the National Salt Reduction Initiative. We're working with 28 companies very closely to reduce the sodium in the foods that they produce by 25% to bring about a 20% reduction in sodium intake at the population level. So we're really working on changing the environment to support people in making healthier decisions to choose those products which are lower in sodium. We're also working on baby-friendly. So baby-friendly hospital status is a World Health Organization designation that essentially works with hospitals to become more supportive of breastfeeding. So our goal here is to increase from 2 to 12 the number of New York City public and private hospitals that are certified as baby-friendly. That will mean that about 80,000 births in New York City over the next 5 years are impacted. So the way we're doing that is by establishing a collaborative and working with hospitals. So they'll be doing things like allowing babies to room in with their moms at the time of birth. We'll be working to have certified lactation consultants trained at hospitals to help women learn how to breastfeed, because it's not always the most natural, innate thing. It's harder than a lot of women realize when they get started in doing it. So there are going to be numerous things around the hospital environment that can be done to support women in that choice. And then finally, in terms of healthy eating, we're working on something called Shop Healthy New York City. This is a project where we work with all types of food retail venues to increase access to healthy foods. So we're working with supermarkets, corner stores, which we call bodegas, farmers markets, and mobile food vendors to increase access to healthy foods. We do this in our food desert neighborhoods or our high-need areas. We do it by changing the inventory in the stores, these retail settings. We change the marketing of foods in those stores, and we just generally change the food environment. So Stores are doing things like taking off the advertising of their less healthy foods on their door. They're putting water at eye level in the cold cases in those doors, and they're putting produce near the checkout place in each of those stores. We're also, for the first time in New York City, making we're making Health Bucks available at all farmers markets. And Health Bucks are $2 coupons that allow people to purchase fruits and vegetables at a farmer's market. So they basically get $2 worth of free vegetables at those farmers markets. If they use their if they use their EBT card to use their SNAP dollars, which are food stamp dollars, every time they spend $5, they get an additional bonus of $2 towards produce. So it really is a way to help people purchase the foods that are healthiest for them. Okay, now I'll transition quickly to active living, and we'll be hearing more about this from Commissioner Burney, but we're working to expand play streets, and we're working to expand the adoption of the active design guidelines, which were developed in New York City several years ago. Essentially, play streets are opportunities to open up a street for physical activity. We do this adjacent to schools, and we do it in community settings, in places where there isn't ready access to parks or gyms or other facilities where people can engage in physical activity. And finally, we're working to increase adoption of our active design guidelines. These are guidelines that we work with architects, urban planners, and builders around so that they can build buildings that support physical activity and stair use, among other things. So I want to thank you very much for your time today and look forward to speaking to you a little bit more.